All right, it looks like we are live. Hello, everyone. Thank you so much for joining us today for today's webinar on Medicare, which if you find to be a confusing topic, you are not alone based on the couple of hundred people that are here joining us today. I'm Samantha Hendrickson. I am a medical business and healthcare reporter with the Columbus Dispatch here in Columbus, Ohio. And today, I am joined by a team of Medicare experts to help us ease some of that confusion around Medicare, as well as help you understand what to look for when choosing Medicare coverage. So with us today, we have Chris Reeg. Chris Reeg is the program director of the Ohio Senior Health Insurance Information Program, housed within the Ohio Department of Insurance, which counsels nearly 200,000 people each year and has saved Ohioans over $300 million since 2013. We also have Amanda McFarland. Amanda McFarland is the individual sales manager for Medical Mutual, supporting the Medicare and individual markets. Amanda has been with Medical Mutual since 2015 and has more than 20 years of experience in the Medicare industry. Finally, we have Katie Goff. Katie Goff is the Medicare Pharmacy Director, overseeing operations, quality initiatives, pharmacy information, and data analytics. Katie has been with Medical Mutual since 2015 and has more than 20 years of experience in the Medicare industry. Before we dive in and hear from all of our wonderful experts, we have a short video from today's sponsor, Medical Mutual.
Medical Mutual is the right call for Medicare Advantage.
We don't have to pay that large amount when it comes to his medication. Sometimes it's like zero.
Benefits like $0 copays on prescription drugs and doctor visits make Medical Mutual the right call for Ohio seniors.
I'm Francis, and this is Robert, and Medical Mutual is our Medicare Advantage.
Make the right call for better Medicare benefits. Medical Mutual, Ohio's hometown Medicare insurer. Medical Mutual.
All right, thank you, Medical Mutual. We're going to go ahead and get started then. First, we will start with Chris. Chris, can you help us understand the different parts of Medicare and what the options are for coverage once someone becomes eligible for Medicare?
Yes. First, thank you so much for inviting me today. I feel like one of these things is not like the other. I am with the Ohio Department of Insurance, the OSHIP program that provides objective and unbiased information with regards to Medicare. So to clarify, we do not recommend any particular company, product, agent, or brand. We just want to provide the objective information. So I believe there's a slide they'll show that has kind of the 5,000 foot view, maybe 500,000 foot view of what Medicare is. So to lead off today's event, we just want to give all of the viewers out there an idea of what Medicare looks like. If you are eligible for Medicare, you're 65 or older, any age and disabled, typically for 2 years, or you've been diagnosed with end-stage renal disease or maybe Lou Gehrig's disease, you likely qualify for Medicare. When you're on Medicare, you have two very general options. Option one is to remain on original Medicare. That's your red, white, and blue card. Medicare Part A, that covers, it's listed as hospital or hospitalization, and Medicare Part B, which is your medical. Original Medicare is there to cover the majority of your healthcare costs, not all. So individuals who are on original Medicare Part A and Part B as their primary health insurance typically have a second card in their wallet, a second insurance plan to pick up what original Medicare does not cover. Some folks may have a group health insurance plan or GHI. Those are becoming fewer and far between as retirement plans don't always offer insurance to retirees as a benefit. What's more common is if folks have limited income, limited resources, they may qualify for Medicaid, the assistance programs through your county job and family service office. And even more common is that folks buy Medicare supplement insurance, also called MedSup or Medigap. This secondary insurance is insurance that you purchase privately from a company. It is designed to pay after Medicare and only after original Medicare Part A and Part B. I might be overstressing this because we find a lot of folks confuse Medicare supplemental insurance with the Medicare Advantage plans, and they're very opposite. So Medicare supplemental insurance, again, private insurance you purchase to pay after original Medicare. It's not an enrollment period coming up for that. As long as you have that plan, you're going to continue with it. You can review it at any time, but you're not receiving update notices about your supplemental plan right now. Carrying on with this option one, since about 2006, you have a third card in your wallet. That third insurance is to pay for prescription drugs. Again, some individuals may have prescription drug coverage as a retirement benefit, perhaps as a veteran, but it's more likely that you're shopping for Medicare Part D, the prescription drug coverage. And it's offered in standalone plans for individuals who have Medicare, some type of secondary insurance, and then they choose their prescription drug plan. The alternative to that, option two, is Medicare Part C for choice. You can choose to get all your Medicare benefits, your Medicare Part A, your Medicare Part B, and typically your Medicare Part D in one product. So you have one card in your wallet. You're choosing that private plan. Now, last year, for the first time, we saw a little bit of a pivot. We now have more individuals in this country in Medicare Advantage plans than on original Medicare. It's just slightly past the 50-50 mark. So it's very important for everyone at this time of year to first of all sit back and look at this and figure out where you are now. Are you on original Medicare? Do you have a supplement policy? Are you simply shopping for prescription drug coverage? Or are you interested in Medicare Advantage plans? These are typically managed care plans like HMOs, a health maintenance organization where you have to utilize the network of doctors and hospitals. They could be preferred provider organizations. It's preferred. You use those providers for the lowest cost, but you have some out-of-network coverage, or even a special needs plan for maybe some targeted demographic like low income, or a chronic care, or institutionalized coverage. There's a lot of options out there. We are fast approaching the October 15th Medicare annual open enrollment that runs through December 7th. And that's the time of year we would like all of Ohio's 2.5 million Medicare beneficiaries to review their health and drug care coverage. And then if they need or want to make a decision, do so before December 7th, so that ideally you're in the best plan for you as an individual on January 1st. Now, there are so many nuances that you're going to hear today, so many updates that you're going to hear today, and I hope we have time to answer all questions that you have. Again, we could talk about the overview of Medicare for hours, but I don't want to take up any more time before we get into what's new and answer those questions.
Thank you so much, Chris, for that information. Now that we have a little bit more understanding, and thanks to you, I'm sure that our listeners would love to talk about a little bit more specific. So, for example, when someone can enroll in Medicare coverage. The first question I have here is, what are the most common eligibility periods for Medicare Advantage plans?
Well, I mentioned that you're on Medicare when you turn 65. That's our largest population, or those after typically 2 years of being disabled. You have an initial enrollment period that begins 3 months before your 65th birthday. So that's a great time to review all your options and make your coverage selections for when you're first eligible. But then every single year, October 15th to December 7th, as I mentioned before, we really want every Medicare beneficiary to review your health and drug care coverage. And, I don't think we're in the habit of reviewing insurance annually, your car insurance, your homeowner's insurance. But it's imperative that you check your health insurance to make sure medications are still on the formulary, providers are still in the network, costs haven't changed too drastically. And then so your new plan would start January 1st. There is a Medicare Advantage open enrollment, January, February, and March, that would allow you to select a different Medicare Advantage plan or go back to traditional Medicare. Again, it's Medicare. We always have a nuance. There's also special enrollment periods based on individual situations. So I would really stress, if someone has something going on in their life, they move, they go into a long-term care facility, they're in somewhere with a state of emergency, as we're watching the weather for Florida closely. Check with OSHIP, check with your plan. See if you have a special enrollment period based on your situation.
Thank you, Chris. We talked about reviewing for sure annually, but what if a person already has Medicare? Do they have to renew it during that annual enrollment period?
They do not. Once you're on original Medicare, Part A and Part B at first, and you make that initial decision into your plan, you have coverage. You're not going to be without. But again, review those plans. We often stress that during this open enrollment period, doing nothing is a choice, and you're choosing to stay typically with your current coverage. Now, we also want folks to be very aware. I know their mailboxes are overflowing with marketing material, their phones filling up, but check for mailings from your current healthcare plan. This is the time of year they're sending out notices of change, which would include if your company is leaving your area, and you would have to make a choice. Regardless, if you do nothing and you're in a plan that is leaving, you would be back in original Medicare. But it's an individual choice. So take this opportunity during the open enrollment to review those options.
Married couples, do they have to share the same Medicare plan?
Nope. So I think, all your working life, typically, married couples on the same insurance plan. You get to Medicare, and I get it, it's easier, but you don't have to be on the same. The spouses may have two completely different healthcare needs. And I keep saying individual, and that includes husband and wife. Married couples of any sort need to make those individual choices.
And speaking of individual choices, does a person need to sign up for Medicare Part D drug coverage if they're currently not on any medications? Or can they add Part D later when they might need prescriptions?
If you wait and add Part D later when you need prescriptions, you run the risk of getting a Medicare Part D penalty added to your monthly premium. So the general rule of thumb is when you're ready for Medicare Part B as in boy, the medical benefit, it's time to sign up for your prescription drug coverage. If you choose not to take a Medicare Part D plan and you enroll later, maybe during this annual enrollment, coverage would start in January, they'll assess a 1% penalty. I haven't talked about that in a while, for every month that you delayed taking that coverage. So we don't want to see that. We don't want to see folks getting a penalty. Exceptions to every rule. If you have creditable drug coverage, so an employer's retirement plan, veterans benefits, any drug insurance that's equal to or better than what Medicare Part D has to offer, you can keep it. If anything would happen to that, you would be able to enroll without delay and without penalty. So I think this is an imperative year to look for those notices. Those drug plans must provide you with a written notice stating if it's creditable or not. So Katie's going to share some good news later about a cap on your drug costs. Which brings into question whether or not employer plans will still be credible. If you get the written notice stating that it is, you can stay on that plan without fear of the penalty.
Perfect. Thank you, Christina, for all of that information. I'm going to move on to talk to Amanda about some things. But first, now, more and more people are working past that eligibility age of 65 that Christina mentioned. And according to the Bureau of Labor Statistics, employment of workers age 65 or older has grown by 117% within 20 years. And employment of individuals 75 years or older has also increased by roughly the same amount. Amanda, what do those folks need to know about enrolling in Medicare?
Yeah, so every person's situation is going to be different. And one of the big things that they need to look at is the size of their group plan. So groups that are under 20, Medicare is primary. So all that means is when they go to the doctors, Medicare is going to pay first, and then their group plan would pick up secondary. For groups under 20, they have to enroll in Medicare because that Medicare is primary. And if they don't, then they're going to be responsible for the claims that Medicare would have picked up. Now, if the group's over 20, they can defer Medicare until they retire and then pick it up. But regardless of either of those situations, when that member goes to retire, they have what Chris referred to as that special enrollment period. So when they lose that employer coverage, they can enroll in a Medicare Advantage plan at that time. So if they decide to stick on that plan, they can. But I would also encourage looking at their options because it might be advantageous to come off the group plan when they turn 65.
Great. Thank you, Amanda. And speaking of options, if a person who is 65 or older has health insurance through their spouse's workplace, can they keep that coverage and add Medicare?
Yeah, they definitely can. The same rules would apply that we just discussed. So there could be situations, again, where they're going to have to enroll in Medicare and pay that B premium, even though they're on that group plan. So again, I encourage, as you're nearing 65, to reach out to somebody and have them do a comparison of your employer plan and of the other Medicare Advantage options out there, or Medicare supplements, whichever one's the best fit for that member. Because again, they could save money by coming off of that employer plan and have equal to benefits, or potentially even better benefits now with the prescription drug cap.
When you say someone, who exactly do you mean when you can reach out to someone about this information?
Yeah, so of course, Chris's team, and then you could also contact Medical Mutual. We have a team that is there. And then the market that I support is actually our external brokers, and they represent not just Medical Mutual, but other carriers as well. So there's a variety of options available for you out there to be able to do that comparison.
Awesome. Thank you so much, Amanda. It's really good to know that there's help available. I'm sure for anybody listening that they would agree, especially when, again, we're trying to break down something that might be a little bit more on the confusing side. Aside from an agent or a broker or reaching out to that one person, what other resources are available to consumers? You mentioned we have, where Christina's from, and Medical Mutual. Your line of work. I'm sorry. Got lost in my notes there for a second. Yeah, if you can just expound on that a little bit more.
I think I would share 800 Medicare is always an option too. 24 hours a day, 7 days a week. They're a great starting point, as is OSHIP. We're Monday through Friday, 7:30 to 5. Objective information, unbiased, to help narrow it down to see what's best for you. Our role is to provide you with education to make good decisions for health and drug care coverage. And then I know Amanda mentioned, there's local agents that this is their livelihood. They're there to do things right for you and be there when things don't go wrong, as is OSHIP. The one thing I would stress is who not to call, and that's anybody that calls you. Please, this time of year, your cell phone might be ringing nonstop with solicitors. Those are often individuals from out of state, brokers that don't take the time to look at the network of plan, the formulary of plan, and help you make an educated decision. And just on that same note, never share any personal information with anyone that contacts you in that manner.
Mm-hmm. Awesome. Thank you guys so much for your answers. So we've gotten a lot of information from our panelists so far, but now how do we pick the coverage plans that we're learning so much about? The Medicare annual enrollment period begins October 15th, and many people will begin reviewing their Medicare coverage and making those changes for the upcoming year. And, Chris, you already spoke to this, but is it a good idea to review your Medicare coverage every year. Talk a little bit
It
more.
is. Yeah. Again, I know somewhere in that mail, you should have your annual notice of change highlighting what is changing for your specific plan. That kind of is the great starting point to looking at the options then for 2025 to see if there's something better. To kind of simplify it, we always say look for cost, coverage, convenience. Certainly make sure you know of any costs that are going up, monthly premiums, primary care physician copays, formulary. Make sure your medications are still maybe on a lower tier of those medications. Coverage and convenience, make sure your providers are still in network. Now, providers can leave a network sometimes off times during the year based on their contract, but we want individuals to make sure the providers care that they want going into the plan is in the network. And be aware of any restrictions or any need for prior authorizations. The more you know before you sign up for the plan, the less likely you are to end up in a bad situation where you're blindsided by a bill or a denied claim.
Yeah, and just to call out a few other things, I think this year, really more than normal, we saw some market disruption that we had not previously seen in years past. And there are certain carriers that are no longer offering certain plans within an area. So you may not get that ANOC, you may get a notice of termination, and don't panic. Again, this gives you the opportunity to move to a different Medicare Advantage plan, or in those situations, you could actually even move to a Medicare supplement plan if you're losing that Medicare Advantage. So just be mindful of that. And again, looking at the ANOC benefits to see what benefits did change. Because again, we're seeing a lot more changes come through this year in the competitive market than we have in years past. So make sure that you're reading that ANOC, as large as it is, and reaching out and asking the questions.
I'm going to put an exclamation on what you just said, because that's a very good point. We didn't mention that Medicare supplemental insurance, when you're new to Medicare, you also have an open enrollment. But after that, they're medically underwritten. And you may or may not be sold. But if your Medicare Advantage plan is terminating and leaving the county, you would have a guaranteed issue to pick up certain supplement policies if that's the option you choose.
Wonderful. Thank you so much. So you heard it from our experts. Review this coverage and make sure that you understand these changes. But what if somebody has decided they want to shop for a brand new plan? What are the most important things to consider when choosing one?
Yeah, so I think that there's a lot of things. I think where most of the time you need to start is provider access. So ensuring that all of your providers are in that carrier's network. It's not going to help you if their benefits are good, but they don't cover any of your providers, because then you're not going to have coverage. So verifying provider status, and then next I would say verifying prescription coverage. So each carrier covers a list of medications, and those lists are the drugs that are covered. So I think there's a lot of, not to steal Katie's thunder, but I think that there's a lot of misperception out there of now members have this new $2,000 cap and that's all that they're going to spend. But the reality of that is that that's just for covered drugs. So if they're taking a drug that's not on the carrier's formulary, it doesn't apply to that $2,000. So ensuring that your drugs are covered, your providers are in network, those are the two biggest things. And then I think you can start getting into the nitty gritty benefits of what are the copays, out of pocket maxes, and things like that.
Wonderful. Thank you. Katie, anything to add regarding during cross formularies and anything to add to what Amanda already mentioned about prescription drug coverage?
Yeah, I would just add, and I know it was touched on, that pharmacies also play a critical role. And many of us have a very good relationship with our pharmacies locally. There have been a lot of changes in that market space as well, many people impacted. I'm not sure how many know that Rite Aid has exited the market. So for those of you who use them, you do have to consider your other options. But the good news is most health plan carriers do allow coverage with a whole host of different pharmacies, and we must meet certain access requirements to afford you that ability to get your drugs. So I just say pharmacies are also part of that equation.
Great. Thank you, Katie. Thank you, Amanda. According to a Kaiser Family Foundation poll, roughly half of U.S. adults are concerned about healthcare costs or have difficulty affording healthcare options. When shopping for a Medicare Advantage plan, how can seniors be sure that they are choosing an affordable option?
Yeah, so I think kind of going back to what I previously said, again, doctors, medications are key, but then after that, you're going to want to look at the actual benefits of the Medicare Advantage plans. There's several zero premium Medicare Advantage plans out there. Those are typically, honestly, the ones you see sell the most. So looking at the premium of the Medicare Advantage plan, and then what are you going to utilize the most? Generally, you're going to go to your doctors and potentially your specialists. So what are those copays? We also recommend looking at the MOOP, which is the max out of pocket. And what that is just like your worst case scenario for a year. Like heaven forbid, you have a catastrophic year. What is the most you are going to pay on this plan? So make sure that you're looking at that. And then the nice thing about Medicare Advantage plans is they can provide coverage above and beyond Medicare does. So look at the plans and see if they have dental coverage, see if they have vision, hearing, over-the-counter benefits, grocery cards, things like that, to see which one's going to best fit your needs.
And I'd add, I like that those are the extra benefits. I know here on our hotline, we get a lot of calls. We've even had folks upset that the Medicare website won't order the Medicare Advantage plans from, the highest over-the-counter debit card to the lowest. So we really stress, look at those things Amanda mentioned first and foremost, the formulary, the network of providers. Make sure your health and prescription needs are taken care of first. And then if there's added benefits, that's wonderful. I get it. And know the limitations. We also have some folks calling up saying, I need a root canal. Will my Medicare Advantage added dental coverage? Usually not, but check with the plan. If you're looking at those added benefits, please check with the plan to know the limitations.
Yeah. And just to kind of circle back to the prescriptions, not only is it important to make sure that your prescriptions are covered, but it's also important to see how they're covered. Some carriers are going to give you a zero copay for the lower tier medication. So there's a way on Medicare.gov or through an agent that you can do a prescription drug cost analysis where it'll tell you how much you will pay for every single medication that you're taking. So those are important too. If each carrier covers your drug, but one of them's covering it at a lower copay than the other, then that other one might be a better option.
Got it. Thank you guys so much for that information. I'm going to move on to another topic that we visited a little bit here, but prescription medication can be an expensive part of that healthcare. However, the Centers for Medicare and Medicaid Services have made some changes for 2025 that help reduce those out-of-pocket costs for consumers. Katie, can you please tell us about those changes?
Yeah, so we've got a lot of great changes for Medicare Advantage members out there for next year. As the team has mentioned, the out-of-pocket amount that used to be required a member pay before their costs went to $0 was $8,000, and that is moving to $2,000 in 2025. Basically, once you hit that amount, all of your Part D covered drugs will go to $0 cost share for the rest of the year. It will start back over every year. Another new thing that is being added is what is called the Medicare Prescription Payment Plan. So this gives members the ability to spread out their drug costs and pay through monthly installments directly to the plan instead of at their pharmacy. And then we also have the removal of the coverage gap. many people have heard this termed the donut hole. The donut hole was a big pain point for a lot of Medicare Advantage people and just Medicare Part D users in general, where there was a lot of cost involved. They're completely eliminating that. And so it's a good thing for Medicare pharmacy users. And then I'll get into, if we go to the next slide, a little bit more information about the prescription payment plan. So like I said, it's a voluntary program. It helps manage spreading your out-of-pocket costs through the remainder of the calendar year. Anyone with Medicare drug plan or on, we're differentiating drug plan and Medicare health plan. So these are Medicare Advantage plans with prescription drug, and there are other types of plans also available for this as well. But your participation is voluntary. You just need to call or visit the health plan or the drug plan's website. You can also contact the plan and sign up for payment options starting October 15th. So all great news, unless you have a special election period or something to that effect that began October 1st. So how does it work? Instead, like I mentioned, you no longer, once you've opted in, you no longer have to pay your pharmacy for the medication. You will leave the pharmacy without paying. That information then gets billed and by your health plan every month to you. This monthly bill, so you're still responsible for the cost of the medication itself. It's just spread out over whatever remaining months from the time you've opted in through the remaining part of that calendar year. So it's essentially divided by the remaining months in the calendar year. And it's, based on anything you've paid previously will also get factored into that. But it is incremental payments instead of the one-time cost that you would have to pay currently. There are certain people that benefit from this over others, and there are some that probably should really consider not signing up for the program. So, you have very low drug costs as it is. It might not be worth it for you to opt into this. There's also those who are considering signing up late in the calendar year. Again, it's just going to be spread out over the remaining months in that calendar year. So not ideal for someone who is looking to sign up in October for the remaining part of the calendar year. And you also don't, those who don't want to change how you go about paying for your drugs, or maybe you can afford what you pay currently to the pharmacy. Because that cost is going to be limited with the maximum out-of-pocket cost to $2,000, it may not be something that you want. It's a misconception out there that this is going to just make some nice, easy set payment for you through the remaining part of the year, but it does not mean that your payment to your health plan will be static, meaning it won't be, as an example, $10 every month or what have you. It could change and fluctuate because you're constantly filling medications that add to that balance. There's also people that already are receiving extra help. Or through a Medicare savings plan or some other program that supports them with prescription costs. These people should really consider whether or not the Medicare prescription payment plan is right for them.
Okay, thank you so much, Katie. Really appreciate it. Last part here, we're going into what other than cost. I know, Amanda, you touched on this a little bit, but what other than cost should someone compare when shopping for a Medicare Advantage plan?
Yeah, so I think, again, kind of if those basic benefits are lining up, you're getting your doctors covered, your prescriptions are on that formulary, and the co-pays or co-insurance is affordable, kind of the basic Medicare benefits line up, then that's when you would dive into those extra benefits like dental, vision, hearing, OTC, transportation, things like that. The other things that you can look at is what type of programs does that carrier provide that will help you with health coaching? Do they have a diabetes management program if that's something that you have? Do they have wellness programs, care coordination, things like that to help you manage those chronic conditions? And then the final thing is really big, and that's their customer service. So, if you have an issue, that's who you're going to have to call to get it fixed. So what type of service do they provide? Are they local to where you're going to speak with local people, or is it, off seas, things like that? What are their star ratings from a customer care standpoint? Those are important things that I would look at next.
Christina, Katie, anything to add to what Amanda just provided for us?
No, it sums it up. Medicare is very comprehensive, and every county has multitudes of options available. But it is very easy to break it down into digestible pieces to find out what's best for you. So I think Amanda laid it out very nicely, what to look for in Advantage plans if you're on option 1, original Medicare supplement, what to look for in the drug plans as well.
Yeah, and I'll just add from the drug plan perspective, I know Amanda touched on this. Medicare.gov does have a plan finder tool, and all of the health plans out there also have search engines where you can evaluate drug costs. We highly encourage people to look at that. I know oftentimes, the medications that members are on, they can take alternatives if they talk with their doctor about it. Maybe it's something they don't want to take an alternative and they want to stay with the medication that they're on. It's very important that you look at all of those nuances when investigating on those tools. Just to see how that sort of thing fluctuates. Even depending upon the different pharmacies, a lot of plans out there have preferred pharmacies where they offer better cost share when you utilize those pharmacies over another. So highly encourage you to look at multiple pharmacies and all of your drugs, the way that you prefer to take them, and see exactly how everything matches up.
And I think I'll go back to read your mail. I'll use my mom as an example. She's currently on a $5 monthly premium prescription drug plan that we know is not returning next year. She's being what's called crosswalked to a different plan within the same company that's going to be $40 a month. So if I didn't review the annual notice of change and January rolled around, I would have been kind of surprised to get a bill that was 8 times more than what we were used to paying. So reading the literature that's coming from your current plan is a great starting point, and then jumping into reviewing all those different points.
Okay, thank you all so much. Really, really appreciate all of your expertise and the time that you've taken here today to teach people more about this really, really important coverage part of their lives. Let's see. I do believe that we have some questions from our listeners that our team is going to try to help us gather up here. And then Amanda and Katie and Christina will be answering them as they to their expertise. We are really hoping for some good questions, so get those in there on the Facebook live stream if you can, if you have questions. And it looks like we do have our first question from Pab. How do you compare customer service for Plan G?
So
I can go ahead and try to take a stab at that. So if you're not familiar with what Plan G is, it's a Medicare supplement plan. So at the very beginning, Chris explained, Medicare supplements, you keep your original Medicare and then you have the other card that the insurance carrier picks up the secondary. So The thing with Medicare supplements is Medicare is always going to be like the primary customer service, if that makes sense, because they are that primary processor. So customer service is still important from that secondary standpoint, but really things have to be correct on the Medicare side before that carrier's payment even comes into play. So if we're not getting information from Medicare, that carrier isn't able to pay. So you probably, if you have a Plan G or a Medigap or Medicare supplement, whatever you want to call it, you're probably dealing with Medicare more often than you're dealing with the insurance carrier. Whereas the Medicare Advantage plans, the insurance carrier administers all of those benefits on behalf of Medicare. So you would never contact Medicare. You would only contact the insurance carrier.
I'd like to add, though, to it. I know the question was specific to Plan G, but for those of you who are like, well, how do you identify it for Medicare Advantage? We get scored as a Medicare Advantage plan on a set of quality measures that the government sets out, and it's called our star rating. And that information is available on Medicare.gov. There's a whole host of things that we get scored on. Customer service is one of them. And so you can really look at our customer service score as a health plan, MMO. Any of the health plans out there also have the same score. So we encourage people to really take a look at that, not just at the overarching score, the overall star score, but also those individual things like customer service.
And I always encourage folks too, because like Amanda said, with the supplement, whether it's a Plan G or one of the other standardized plans, folks can call OSHIP and we can do a price comparison of premiums for all the plans that are available in their area. We encourage folks, call the company, talk to them, get a feel for the customer service. But then, if you're making a confident purchase with that policy, moving forward, you can contact them. But really, it's kind of hands off. Medicare is going to pay the claim. Almost all of those companies now have what's called a crossover agreement. So Medicare is going to send your claims directly to your Medicare supplement policy for payment. So we're very fortunate. We don't get many calls about that, but we do get calls for folks shopping.
Wonderful. Thank you, guys. Looks like that is our only question so far, but please keep them coming. Please keep them in. We have experts here at your disposal. So please go ahead and go for it. But for right now, is there anything that we haven't touched on yet in this webinar that's come to mind as we've been sharing all this information that any of you experts would like to share?
I'll post one. Every time we do a webinar, this question comes up, and it almost circles back to what Amanda was sharing earlier about if you're still employed. We have a lot of folks saying not only are they still employed at 65 and retirement's not even in sight, they're often contributing to a health savings account. So the question we get is, should I take Part A? Part A is generally premium free, but we want to stress to individuals that you have to stop your contributions into a health savings account 6 months before you get your Medicare Part A. And this isn't a Medicare rule. It's not a Social Security rule. It's actually an IRS rule. So because that comes up so often, for anybody that's listening that's still employed and paying into that health savings account, I would encourage them to start making a plan ahead for when you think you might be retiring, and start working with your benefits administrator through that company as to when you're going to stop those contributions. Now, after Medicare comes to be and you have money in that account, you can use the money in the health savings account to pay for your out-of-pocket costs against Medicare. You just want to cease those contributions.
Great. Thank you so much. Amanda or Katie, anything else that's coming to mind for you as common questions asked in webinars past that might be beneficial to our listeners?
I think probably, again, Chris touched on this at the beginning, but, right now we're in the midst of AEP. And again, this is a big time that everybody kind of should be reviewing But if you miss that, you do have that open enrollment period from January to March that she explained to make a one-time change to a different Medicare Advantage. So don't panic if in January you go and something has changed and a medication's no longer covered. You still have that one window to do that. But we encourage you to get that done now so that you don't have any lapse in benefits and that you're on the appropriate plan for January 1st.
Yeah, and I think I would add, with these big changes that are occurring to the prescription drug plan, for those of you that are on employer coverage that are aging in or are going to be Medicare eligible starting in 2025 or even beyond, but immediately in 2025, you really need to evaluate your credible coverage letter from your employer. So just evaluate that. That does have an impact on what Christina said earlier about the late enrollment penalty. Again, if you're on credible coverage, you don't have any immediate need to elect for Part D so long as you're able to stay with that coverage beyond. But if you do have to come off that coverage, it is extremely important that you verify that it is credible. And if not credible, you should seek a Part D plan to avoid that late enrollment penalty.
Well, I actually have a question, if that's okay, as a young person with grandparents and aging parents. What, if anything, should younger people know about Medicare as they're trying to support their aging family members? Is there any way that they can assist or help during this time in their lives?
I actually love that question. We used to say, talk turkey about Medicare. Oftentimes we get together with friends, family, loved ones over Thanksgiving. So it was a great reminder for the multiple generations to talk to their older relatives, friends, or whomever they're in contact with, like, hey, just a little nudge. Did you review your health plan this year? Are you in the best plan? It's open enrollment. What are you going to do?
Yeah, I would even add to that. I've been in the same position myself. The tools that are out there are great. And, the resources that are available are also great. So there's a lot of local brokers, health plans that have agents like Amanda had mentioned, OSHIP. We've got a lot of great resources in the state of Ohio here that can help you free of charge. You just work with them on finding what is best for you. Come ready for those appointments. If you are sitting with someone, have the list of medications ready, have the doctors that are being utilized, the hospitals that are important to you, and come really ready for that appointment. I know it's a complex world. I always encourage someone, especially the first time that they're entering, to sit down with someone. You can do it solo and you can go on Medicare.gov, but it is a lot of information and we understand that. So it's just as easy to pick up a phone call, to make an appointment to sit with someone, but have all of that information ready so that they can best help you.
And it looks like Heather in the comments here had the exact same question, I think at the exact same time that I did. Heather and I have like minds, but there's anything that you would add to Heather's a little bit more specific question, especially for a parent who needs assistance? How would you direct their adult children to assist when helping pick a plan?
I mean, again, I would recommend reaching out to somebody that knows what they're doing and can do that. My grandma is Medicare eligible, and I have an agent that I work with every year to run her medications, make sure that she is still on the best plan for her needs, because we know that people get bombarded with mail. And typically, when things look too good to be true, they might be too good to be true for your particular situation. So I would say make sure that you're getting the correct whole package and that you're not just purchasing for that one benefit.
Great, thank you. And we've got some good questions coming in, I see. So next one is, do different supplement plans pay different amounts for various medications?
I guess I'll jump on that one first. That's a great clarifying question. Remember, option one had 3 different cards in your wallet. Card one was original Medicare, paying primary for health and medical. Card two was the supplement to pay after and only after Medicare Part A and Part B. So Medicare, original Medicare, and supplements do not have a prescription drug benefit. If you're in option one to have prescription drug coverage, you would need to select a standalone prescription drug plan. Ohio has 20 this year. We're going down to 16 standalone prescription drug plans in 2025. So if you're in option one and you just want to compare prescription drug plans, please do so, because we are seeing changes with those standalone plans.
Great, thank you, Christina. What is the difference between a PPO and an HMO POS?
I can go ahead and take that. So PPO is Preferred Provider Organization, and an HMO is Health Maintenance Organization. POS is Point of Service. So what that means is, under an HMO, you are typically limited to a set network of providers, and outside of that network, with the exception of emergency and urgent care, those providers would not be covered. So generally, under the HMO plans, you're going to see lower copays and stuff like that, because you're kind of restricted to this network of doctors. Under a PPO, you still have the network of doctors, but if you go outside of the network, you would be covered just at different copays. So I'm making these numbers up, but maybe in network you have a 0 copay for a primary care, and if you went to an out of network special or primary care, you would have a $10 copay. So it gives you more flexibility, but you're going to have higher costs by going to an out of network provider. Most of the Medicare Advantage plans we see sell are HMO, because again, you have those richer A and B benefits under that HMO network.
I would also like to add, a lot of people with the Medicare Advantage plans, you may be on an HMO POS, like Amanda was talking about, where you're restricted medically to only go somewhere except for emergent and urgent situations. But you can still, a lot of the pharmacy drug coverage is nationwide, meaning the pharmacies, a Walgreens in Ohio versus a Walgreens in Florida or Arizona, or is still going to be within the network. So it is good to know what matters most. And again, this is situational for people. So for those with more medical costs than prescription drug, it would be important to stay within that area. But if you are a traveler, if or if you're just on drug and you're not, you would have the ability to go and utilize a pharmacy. Should you go to the urgent care and have to be on an antibiotic, you can go to the local Walgreens in Florida and still be on the Ohio HMO.
Great, thank you so much. Another question here: how is nursing home care payment different for original Medicare or Advantage plans?
So I'll hop in on that one. First, I want to stress Medicare is there for medically necessary services. Medicare does not cover long-term care. So if you think of the nursing home as a permanent place of stay, Medicare does not have that benefit. You're either private pay, where you may have spent your income and resources down to Medicaid paid, or perhaps a waiver. What Medicare will pay is a short-term skilled level stay after hospitalization. So if you'd been admitted to the hospital for 3 midnights and you then are discharged, but you have a need for daily skilled level of care, Medicare will cover that stay. We look at a benefit period, there's 100 days covered. Medicare covers the first 20 days at 100%. Starting at day 21, you have a copay. The supplement policies in most cases would help pick up that daily copay. You're not guaranteed 100 days of skilled rehab after the hospital stay either. You have to show that you are improving from that daily skilled care. And we typically see stays of maybe 2 to 3 weeks following hospitalization. Amanda, did you want to speak to the Advantage plans?
I can speak to what I know of the SNF benefit as well. So very similar to what you had said, Christina. The Medicare Advantage plan does cover the SNF skilled nursing facility, and that and it is limited to the 100-day, and then it differentiates. I know this because Part D and the rules for coordinating between Part A and Part D, after they're outside of that 100-day. Some of the self-administered drugs that are still being received, say the person's still in that facility, it would come to Part D to pay. You do have to evaluate that and make sure it is still on the formulary and all of those things, but it wouldn't be part of the bundled payment as part of that SNF stay. So that's a little bit of what I know of it. And Amanda, if you have anything additional.
And I know the Medicare Advantage plans would likely or could have a different copay amount for the stays in the skilled nursing facility. Some mimic the Medicare benefit identically. Others have a different cost. So it kind of circles back to our underlying message. It's important to know those costs when you sign up for the plan. So should you be in that situation, you're aware of your out-of-pocket expectations.
And the great news is too, all of the information that's provided either on the website, the plan specific website that you're interested in, or Medicare.gov, you can look specifically and compare skilled nursing benefits, or if there is long-term care benefits afforded by the plan.
Wonderful. Thank you. Our next question, I think this is definitely one that would be in a lot of people's minds as we talk about just trying to figure out information and have things explained to us. Well, how do we know who is a licensed and certified agent? How do they explain about all the different plans, or do they just push certain ones?
So if you find the right one, they will give you the options and let you decide which one is best suited for you. Now, to Chris's point at the beginning, if they are calling you, they're not supposed to be doing that. So that is, unless you've given them permission to. So those would be ones that we would recommend staying away with. MedMutual does have a site that has some of our key agents listed on it, so that would be an option for you. Chris, I don't know if you have resources that show local agents and who could help them with that. But there's a lot of ways that you could find a local agent that would be able to not push just one plan and show you those options.
Yeah, thanks, Samantha. Yeah, the Department of Insurance, that's your state agency that regulates insurance for the state of Ohio. Insurance.ohio.gov does have an agent locator. So if you can locate the agent, they are in fact licensed within the state of Ohio. Now that we do have out-of-state agents that license in the state. So again, I always encourage you, go a step above, look within your local community, use OSHIP, use Medicare as the objective source. But then when you want to talk to an agent, know someone that knows your local market, knows your networks, your hospitals, and your facilities, that can be a true resource and advocate for you.
Awesome. Thank you. Lots of really great questions here. Thank you all. Is there a deadline for adding a supplement?
There's no deadline for adding a supplement. You can shop for a Medicare supplement anytime that you're on Original Medicare. However, we mentioned briefly earlier, these plans are typically medically underwritten. So if you have, a laundry list of health issues, the company doesn't have to issue that policy. There are timeframes when they do have to sell. And the most common is when you are new to Medicare. When you take your Medicare Part B as in boy, and you're at least 65 years old, you have a 6-month open enrollment for Medicare supplemental insurance. During that time, the company cannot turn you down. So, it doesn't matter how old you are, over 65, how many illnesses, they must issue that policy. Then ideally you keep that policy. But maybe later on your premiums have gone up. You want to shop around for a different supplement policy. You are welcome to do so and make application for supplemental any time of the year. But it may be medically underwritten. We have some limited exceptions to that. We call them guaranteed issue opportunities. And generally speaking, it's if you lose your health insurance through no fault of your own, you would have guaranteed issue rights to purchasing certain supplemental policies. We mentioned one earlier. If you're in a Medicare Advantage plan and you receive written notice that they are leaving, it should also tell you what those options are. But you can go back to original Medicare with the right to purchase a supplemental policy without underwriting. Another one that's coming up, because Medicaid over the past year or so now has been doing redeterminations. If you lose Medicaid benefits, you also have the right to purchase supplemental insurance. If you move, if you're trying an Advantage plan for the first time, there's quite a few nuances. So again, I encourage you, if you're in a unique situation and you're questioning supplement, please ask. Always ask and get the detailed information, how it applies to you.
Wonderful. Thank you so much. We have another question from a listener. I have heard that if you first enroll in an Advantage plan, then you switch later to a Medigap plan, you could have problems. Is this true?
I think this goes back to what Chris just answered. So again, the best time to purchase a Medicare supplement is always going to be when you're first eligible for Medicare, because that's kind of your guarantee issue rate. So there are some exceptions to those, whether you're in a special enrollment period or things like that. What you can't do is enroll in a Medicare Advantage plan because you don't need to use the plan now. And then, 5 years down the road, something has changed medically, heaven forbid you have like cancer now or something, that would not allow you to get a Medicare supplement. So you can always start on supplement and then move to Medicare Advantage. It is harder to do the reverse, starting on Medicare Advantage and move to a Medicare supplement.
Another one that's been coming up recently, and thankfully more in other states, is what happens if all my providers leave my network in the middle of the year? Am I locked into this Advantage plan? And generally speaking, yep. A network change, your doctor, provider leaving the network does not give you a special enrollment period to change plans, and certainly not a guaranteed issue for supplemental. But I will share that if the network disruption is large enough, Medicare, the federal government, can determine that there's a special enrollment period. That is not going to give you guaranteed issue for supplement.
Thank you. If anyone has more questions, keep them coming. We have time until 3:30, but right now it looks like our last question is, I won't be 65 until April. Am I too early to do anything?
I would say no. The good news is next year's plans are already out. So even though you can't enroll until October 15th, agents can discuss those benefits with you now. So we often see people researching 6, 9, 12 months out. So I would say it absolutely is not. If you know you're going to be 65, and definitely if you're looking to retire on that time or just compare the plans that are going to be available to your employer benefits, I would reach out now and start that process, because it can be very overwhelming. And I can assure you, in April, you've probably already received a stack of mail this big. So reach out to somebody that's local and can talk through those choices with you.
Okay, that was our last question. I'm not seeing any more coming in just yet, but as we wrap up, Chris, Katie, Amanda, thank you so much for all of your time today. And again, all of your expertise in answering those questions as they came in. I hope that all of our listeners found this super, super helpful. I certainly learned a lot. And so just grateful for your time, etc. Any last words, anything you would like to leave our listeners with before we wrap up?
Well, I'll start. We can't say it enough. Thank you, first of all, for Amanda and Katie for including me, and Samantha for hosting us today. If you didn't get the one message, it's please review your plan options. Look at what you currently have, and then compare the plans that are going to be available in 2025 and make an individual decision if, only if, you need or want to make a change. And if you do, October 15th to December 7th is the open enrollment window. You have to have that plan election in by midnight on December 7th, or it's a pumpkin. Medicare is not going to allow us to do an outside of open enrollment change. But those will take effect January, and ideally you pick the best plan for 2025 for your needs.
Yes, nothing further to add, Chris. It was great seeing you and being with you again. And to the Columbus Dispatch team, thank you for.
Yes, thank you.
Thank you all again. Then we will wrap up. Bye, all.
Medical Mutual is the right call for Medicare Advantage.
Zero copays, lower deductible, and all my doctors are in the network.
Benefits like $0 monthly premiums, $0 copays on primary care and specialist visits, and $600 in free groceries make Medical Mutual the right call.
My name is Vicki, and Medical Mutual is my Medicare Advantage.
Make the right call for better Medicare benefits. Medical Mutual, Ohio's hometown Medicare insurer.